Tonight it's on blood pressure, but it's not just on blood pressure. What I want to do is clear up a lot of problems. Now, first off, have you ever gotten two different pieces of advice from two different healthcare professionals?
Yes.
Take this or you're going to die. Oh my gosh, if you take that, you're going to die. Yeah, we're going to clear up that and how that can actually happen. But first, I want to explain one thing. This right here was a really unique study talking about how the nervous system controls the entire body and pressure on it may negatively affect blood pressure. It's a unique study.
Now some doctors are trying to find out whether a chiropractic adjustment might not only straighten your spine, but also help hypertension.
Health reporter Sylvia Perez here to explain. Sylvia? Kathy and Ron, many people with high blood pressure would like to find a way to avoid taking medication. A trip to the chiropractor may seem like an unlikely alternative, but an intriguing study is showing that a special kind of neck adjustment is helping some patients lower their blood pressure without drugs.
What makes your blood pressure boil? Stress, too much salt, lack of exercise, bad genes? No one's really sure about the cause, but here's something new to consider that might raise the eyebrows of some conventional doctors. Could it be an issue with the top of your spine?
They took x-rays and showed me that my neck was out of alignment.
Denise Neiman went to a specific chiropractor for pain in her neck. After having a special adjustment, that pain was gone, and so was something else.
My blood pressure dropped tremendously.
Other patients were reporting the same positive but surprising side effect. Dr. George Backwitz, a hypertension expert at the University of Chicago Medical Center, decided to find out if there really was some kind of connection.
We designed a double-blind study to really look and see if, in fact, this procedure was affecting blood pressure.
25 patients got the real adjustment, 25 others got a fake adjustment. The result published in the Journal of Human Hypertension found those patients who got the real thing saw their blood pressure drop dramatically, an average of 17 points. That's equivalent to giving patients 2 different blood pressure medications at once.
So it's pretty significant.
Your upper body's off to the left 2 degrees.
So why would straightening the top of the spine affect blood pressure?
It came completely back to center.
Marshall Dickholt Sr. and Jr. say they know why. The father and son chiropractors believe this area of the spine, called the C1 vertebra, or atlas, operates as the fuse box to the body. If it's twisted and out of whack, arteries and nerves at the base of the brain might get compressed, and that could affect blood flow and nerve signals.
It affects your autonomic, not only your central nervous system, but your autonomic nervous system. That means it can affect every organ of your body.
The technique is used by a small number of chiropractors certified in National Upper Cervical Chiropractic Techniques, known as NUCCA chiropractors. They use x-rays and very precise measurements to determine if someone is misaligned. If so, the atlas is repositioned with gentle maneuvers.
When the spine is misaligned, it can affect all types of things, all types of diseases, conditions. Is there a way that you can guarantee everybody who gets adjusted that all their blood pressure is going to come down? Absolutely not.
There are still a lot of unanswered questions, including who will benefit from this and what actually happens physically when this part of the vertebra is realigned. Dr. Backwitz cautions patients to stick with their proven treatments for now.
This is not available now for everybody, so everybody's going to go rush out. No, it's still investigational.
Dr. Backwitz says there still needs to be a lot of research done on this before mainstream doctors will even consider this a possibility. Most chiropractors are not trained in the atlas adjustment. There are only a few who specialize in this technique. So how long does this adjustment last? Hard to say. It could be weeks or months, depending on the person.
At the 90-day follow-up, the patient still had the exact same results. What's also unique is in every study, the placebo always has an effect. In this study, the placebo had absolutely no effect. For mainstream, and the importance there is huge, because how long is it before mainstream medicine understands that the body is self-regulating? Decades. So first off, I thought it'd be appropriate to show you the education that these people actually go through. Now, high blood pressure. First off, what we're looking at here is the hours of education. Now this is, to get a doctorate, you have to go through so many hours. Now, this is a doctor of chiropractic, and this is a doctor of medical. Now, you can see it's the same number of hours virtually. It takes a few more hours to be a chiropractor than it does to be a drug or a prescription guy, a doctor of chiropractic or a doctor of medicine. And there's more anatomy, more physiology, more neurology, more x-ray, and more orthopedics in chiropractic because we're looking at the neurology and structure behind it. We're not the distribution arm for a pharmaceutical industry. Now this, both schools are trade schools. They're not taught healing. Both, to get a doctorate of chiropractic or a doctorate of medicine or a doctorate of osteopathy, all of those are portal of entry doctors, you have to pass boards. The whole function of medical schools and chiropractic schools and schools of osteopathy are to pass the boards. So right now, I'm going to help you how to pass a board. Considering I ran the board review, I would be the appropriate guy, right?
Right.
So what I'm going to do, I'm going to give you a symptom, you're going to come up with a diagnosis, then you're going to tell me the treatments. Now you have to do this. Now you got to understand, there's 4 national boards to be a chiropractor. Some of these boards are 3 days long. They cover every subject. So I want you to get this down. Now we're going to learn this really quick. So now if I say blue sclera, that means the blue aspect, the white aspect of the eye is blue. You're going to say osteogenesis imperfecta, okay? You're also going to say that this is a condition that can be congenital. It's also shaken baby syndrome, and you're going to know the therapies for that, okay? If I say scissors gait, you're going to say cerebral palsy. You're going to say lack of oxygen at birth, birth trauma, okay? And then you're going to name the appropriate therapies, okay?
Sure.
If I say pain and numbness of the lateral thigh, you're going to say neuralgia paresthetica. That is compression of the lateral femoral cutaneous nerve syndrome, common in people that are contractors with tight belts or people with hot bellies. You're going to notice the appropriate therapies for that. Can you understand there's no critical thinking here? If I say disease prevention, okay, you're going to say vaccinations. And this is what I was taught, and even though, of course, now we know that the Gardasil vaccination that came out recently is now causing cancer, and of course flu shots, foreign animal and viral proteins injected into the bloodstream are harmful, and if you do further studies on these, you're going to find out that actual vaccines aren't effective. We're going to talk about that coming up. But understand, there's no critical thinking. Critical thinking is not trained, and it's even not asked for, because your whole goal, you're spending hundreds of thousands of dollars for this degree. Everything is dependent on you passing the boards. You don't care about critical thinking, your students. Going back to the trade school. Okay, trade school, these are the answers that you got to put forth. In actual practice, you're going to find it different. So we're going to do categories. When you get a number, and this is a multiple choice test on your board, when you see 120 over 80 or less than, you're going to put normal. If you see prehypertension are these numbers, hypertension, stage 1, stage 2. Now, if you're presented with a case of chronic kidney disease, what's the blood pressure for that? Can you tell me? 130 over 80. Okay? Now, are these actual facts? Are these studies? Or are these questions on the board? Can you see the problem here? Okay, now this is a pretty big problem because we're not treating people as individuals. We're not diagnosing different problems. We're just trying to take answers. Now, in order to get appropriate blood pressure, this is what both the National Board of Chiropractic Examiners and the American Medical Association all agree how blood pressure is supposed to be taken. It has to be taken at 3 different times of the day, on 3 different occasions over a 2-week span. So this is how it's supposed to go. You take blood pressure at 9 o'clock Monday morning. You find out that it's prehypertension, stage 1 or stage 2, or some type of pathological problem. Well, what you do is you say, now, few things can cause high blood pressure. One thing, a full bladder. Another, not sleeping at night, too much caffeine, dehydration, talking during taking it, any type of stress, physical, chemical, or emotional stress. All of these factors can raise blood pressure. So before I give you a drug that's toxic and poisonous to your system, I want to make sure. Let me check you at noon on Friday. And noon on Friday comes around. Okay, you know, it's still high. Did you make those changes? Did you evacuate your bowels? Do you think the room is cold? Did you get some good sleep last night? Did you drink more water? Did you breathe deeply? Then you check it again. Is it ever done that way?
No.
Of course not. Universally, I've never heard that. What's done now, because remember,